What if the very condition that's been holding you back is the one the VA is supposed to compensate you for, but no one ever told you? Every year, thousands of veterans miss out on benefits they rightfully earned, not because they don't qualify, but because they don't realize their condition is even on the list. See, the VA has a long list of medical issues they'll pay compensation for, some well-known, like PTSD or combat injuries. But others, they're quiet, overlooked, misunderstood, and far too often ignored. You might think your insomnia is just a personal struggle, or that your heartburn, your chronic fatigue, your joint pain are all just normal parts of getting older. But what if those symptoms are actually service-connected? What if they're quietly eating away at your quality of life, while you get nothing in return? In this video, we're going to uncover 6 medical conditions that most veterans don't realize qualify for VA compensation. These aren't extreme, rare cases. They're the everyday issues that creep in after service and silently chip away at your well-being. Some of them could mean hundreds, even thousands of dollars a month. And you might already be living with them. Stay with me until the end, because once you know what to look for, you'll see just how much you might be leaving on the table. And more importantly, what you can do about it. Let's dive in. Chronic insomnia, that's more than just trouble sleeping. It might sound harmless, just trouble falling asleep or waking up more times than you can count during the night. But for many veterans, chronic insomnia isn't just about being tired. It's the lingering effect of high-stress deployments, irregular schedules, and the constant state of alertness the military demands. The body doesn't forget that level of readiness. And sometimes it never truly shuts off again. The VA recognizes insomnia as a compensable condition, especially when it's linked to service-related factors like PTSD, anxiety, or environmental exposure. But here's the part many veterans miss. You don't need a formal PTSD diagnosis to qualify. If your insomnia started or worsened during your time in service, or can be traced back to the stressors and lifestyle you experience in uniform, it can be considered service-connected on its own. And it's not just about sleep. Chronic insomnia affects everything. Your mood, your energy, your memory, your blood pressure. Over time, it can increase your risk for heart disease, weight gain, depression, and even early cognitive decline. Yet far too many veterans brush it off as something they just have to live with. They don't mention to their doctors. They don't document it. And they certainly don't think to apply for VA benefits. But here's the truth. If you lie awake at 2 a.m. night after night, staring at the ceiling, running through past missions or future worries, that's not just bad sleep. That's a health issue. And if it ties back to your service, even indirectly, you deserve to be heard, treated, and compensated. Because sleep isn't a luxury, it's survival. And when you're not getting it, the damage adds up fast. And unfortunately, this isn't the only quiet condition that slips under the radar. In fact, the next one is something veterans often assume is just part of aging, but it might be telling a deeper story. Hearing loss and tinnitus that's been dismissed for years. You might not remember the exact moment your hearing started to fade, but chances are your body does. The ringing in your ears after weapons range, the constant hum of engines during deployment, the roar of helicopters overhead, or the sudden blast of IEDs. For too many veterans, hearing damage didn't happen in one loud event. It built up over time, quietly and relentlessly. And the worst part? Most veterans wait years, sometimes decades, before they realize just how bad it's gotten. They turn up the TV a little louder, ask people to repeat themselves more often, or withdraw from conversations because it's too frustrating to keep asking. But what they don't always realize is that hearing loss and tinnitus, especially when connected to service, is one of the most common conditions that qualifies for VA compensation. Even mild hearing loss or persistent ringing, known as tinnitus, can severely affect your quality of life. It impacts how you connect with people, your ability to work, and even your mental health. Studies have linked untreated hearing issues with increased risk for depression, isolation, and cognitive decline. And yet, because there's no cast, no scar, no visible wound, many veterans don't think they can file for it. But here's what's important. You don't need a perfect diagnosis from decades ago. If your service involved exposure to consistent loud noise, artillery, aircraft, machinery, gunfire, There's already a built-in presumption that your hearing damage is service-connected. Even if your records don't include formal complaint from back then, your current symptoms can still qualify. So if you're hearing ringing when it's quiet, if conversations sound muffled, if you've gotten used to asking what more times than you want to admit, it's not just getting older. It might be the sound of your service catching up to you, and the VA has pathways in place to recognize that damage, compensate you for it, and get you access to the treatment and support you've earned. But hearing isn't the only thing veterans silently lose after service. The next condition is something people rarely talk about openly, even though it affects thousands. Sleep disorders that are brushed off as just stress. It starts with tossing and turning. Then come the restless nights, the racing thoughts, the jolt awake in the middle of the night for no clear reason. At first, you tell yourself it's just a bad week, or maybe you drank coffee too late. But weeks become months. And soon, sleep is something you chase, not something that comes naturally. For thousands of veterans, sleep doesn't feel restful. It feels like a battle. And yet, too many don't realize that chronic sleep issues can be connected directly to military service and may qualify for VA compensation. Sleep disorders like insomnia, sleep apnea, or even nightmare-related disruptions often stem from service-connected stressors. You may have experienced irregular schedules during deployment, lived in high-alert environments, or struggled with persistent hypervigilance. These patterns don't always go away just because you return home. Take insomnia, for example. You might lie in bed for hours without falling asleep, or wake up after just a couple of hours, your body wired for danger. Others experience frequent nightmares, flashbacks, or the need to sleep with lights on. Some rely on alcohol or over-the-counter meds just to knock themselves out for a few hours. But none of this is healthy, and it isn't just part of aging or typical stress. Then there's sleep apnea, another condition that's massively underdiagnosed in the veteran population. Many veterans don't realize their daytime fatigue, morning headaches, or mood swings could be linked to interrupted breathing during sleep. And guess what? Studies have shown that veterans, especially those with PTSD or other service-connected mental health issues, have a significantly higher risk of developing sleep apnea. Here's what matters. If your sleep has changed drastically since your time in service, or if a partner has told you that you stop breathing in your sleep, snore loudly, or thrash around, this isn't just an inconvenience. It's a medical condition, and it's one that could be rooted in your service. The VA recognizes a link between military experiences and long-term sleep disorders. You don't need to suffer in silence or rely on makeshift sleep routines. With proper documentation, even a secondary claim tied to PTSD or anxiety can open the door to benefits, treatment options, and the rest you've been denied for far too long. But sleep isn't the only thing many veterans are losing without realizing why. Up next is a condition that masks itself as aging, but runs far deeper. Digestive issues that aren't just your diet. Everyone experiences stomach trouble now and then, maybe some bloating, heartburn, or the occasional indigestion. But for many veterans, those symptoms aren't random. They're persistent, disruptive, and sometimes even debilitating. The problem? Most vets are told it's just aging, poor diet, or stress. But in reality, some of these issues could be tied directly to their time in uniform and may quietly qualify for VA compensation. One of the most overlooked conditions is irritable bowel syndrome, or IBS. It's not just a sensitive stomach. It's a chronic condition that affects how your gut functions, causing pain, diarrhea, constipation, or both. And it doesn't always come with clear triggers. For many veterans, it started during active duty, often under high-stress environments, long deployments with poor nutrition, or after exposure to contaminated food or water. But even when the uniform comes off, the symptoms remain. Then there's gastroesophageal reflux disease, or GERD. This is more than occasional heartburn. It's when acid regularly rises into your esophagus, leading to chest pain, burning sensations, chronic coughing, or even damage to your teeth and throat. While GERD can affect anyone, research has shown a higher incidence among veterans, especially those with PTSD or anxiety. Why? Because chronic stress can physically alter how your digestive system works, slowing digestion and increasing acid production. In some cases, These digestive problems are secondary to other service-connected conditions. For example, if you already have a mental health rating for anxiety or depression, and that condition contributes to your IBS or GERD, you may be eligible to file a secondary claim. The VA has acknowledged this connection, but many veterans still don't realize it's an option. And it doesn't stop there. Gulf War veterans, in particular, may qualify under the VA's presumptive conditions for chronic gastrointestinal disorders, meaning you don't even have to prove the direct cause if you served in a specific location during a certain time period. So if you've been silently suffering, skipping meals, avoiding social outings, or feeling like your body has turned against you, it's not something you have to just live with. You serve under extreme conditions, and your digestive system may still be carrying that burden. With the right documentation and understanding of how these conditions connect to your service, compensation is not only possible, it's deserved. And what's even more surprising is that the gut isn't the only system reacting to long-term stress and trauma. In the next section, we'll look at something even more personal: the way military service can quietly affect your reproductive health. Without anyone warning you, it can happen. Reproductive and sexual health problems, they're often dismissed. This is the part nobody wants to talk about. But for many veterans, it's one of the most personal and frustrating battles they face after service. Reproductive and sexual health issues are quietly affecting thousands of former service members. Yet most never bring them up. They're embarrassed, or they assume it's just part of getting older. But the truth is, several of these problems are medically linked to service-related conditions, and they can qualify for VA compensation. Let's start with erectile dysfunction, or ED. It's far more than just a physical issue. For veterans, ED can be directly tied to both mental and physical injuries sustained during service. If you've been diagnosed with PTSD, depression, or anxiety, and you're also experiencing sexual performance problems, there's a strong chance the two are related. The VA recognizes this connection, and ED can be filed as a secondary condition to a service-connected mental health disorder. Yet countless veterans are suffering in silence, thinking it's just their fault, or that help isn't an option. But it's not only mental health. Physical injuries, especially those involving the spine, pelvis, or genitourinary system, can also affect sexual function. Nerve damage from surgeries, medications for chronic pain, or even hormonal shifts caused by long-term trauma can all play a role. In fact, some medications prescribed for combat-related injuries or psychological conditions list sexual side effects right on the label, but no one talks about them. Now, consider infertility. For male and female veterans alike, difficulty conceiving can feel like an invisible wound. Few people know that toxic exposures, like burn pits, depleted uranium, and certain chemicals used in combat zones, have been linked to reproductive problems, including lower sperm counts, hormonal imbalances, and miscarriages. Yet these issues rarely get connected to service unless a veteran actively speaks up and pushes for answers. Female veterans face unique challenges. Irregular cycles, chronic pelvic pain, and conditions like endometriosis or polycystic ovary syndrome (POS) are more common than many realize, especially among those who serve under extreme physical or emotional stress. Yet too often, these problems are brushed off as normal female issues, when in fact, they could be service-connected. The bigger issue is silence. These topics are rarely brought up during VA exams. Many veterans feel too uncomfortable to mention them. But here's the truth. If your service, your injuries, or your treatment plan affected your reproductive or sexual health, the VA has pathways to recognize that. You just have to know what to say. And that starts with knowing it even matters. And in the next section, we'll uncover one of the most deeply misunderstood connections of all: how the trauma you endured long ago can still be attacking your immune system today in ways that even doctors sometimes miss. Autoimmune disorders that seem to come out of nowhere. For many veterans, the battle doesn't end when service does. It just changes form. And sometimes that form is invisible, slow-moving, and deeply misunderstood. Autoimmune diseases are a perfect example. Conditions like lupus, rheumatoid arthritis, multiple sclerosis, and even inflammatory bowel disease can appear years after discharge, often without a clear cause. But for some, they're not random. They're linked to military service in ways that are only now coming to light. Autoimmune disorders happen when your immune system turns against your own body, attacking healthy tissue as if it were a threat. The symptoms can vary wildly: joint pain, chronic fatigue, brain fog, digestive problems, skin rashes, but the common thread is inflammation. And here's where it gets important. Inflammation is often triggered by prolonged stress, environmental exposures, or physical trauma. Three things that are far from rare in a military environment. Let's take toxic exposure. Burn pits are one of the most notorious culprits. For years, veterans stationed near these pits inhaled toxic fumes, everything from plastics and medical waste to jet fuel and heavy metals. At the time, most were told it was harmless smoke. But now, researchers are finding strong correlations between exposure to burn pit toxins and the later development of autoimmune conditions. The problem? These diseases don't always appear right away. It can take 5, 10, even 20 years for symptoms to show up, and by then, the connection is easy to miss. Then there's the physical toll. Repeated injuries, chronic pain, and long-term use of certain medications can all play a role in weakening your immune system or triggering abnormal responses. Combine that with high levels of cortisol from combat stress or PTSD, and you've got the perfect storm for immune dysfunction. Yet when veterans show up to the doctor years later complaining of vague, overlapping symptoms, they're often dismissed, told it's just aging, or all in their head. But here's the truth. The VA has acknowledged links between certain autoimmune diseases and service-related conditions, especially when toxic exposure or combat stress is involved. If you've been diagnosed with one of these illnesses and you also served near a burn pit in the Gulf War or handled chemicals like Agent Orange, you may be eligible for compensation, but you have to connect the dots. You have to push past the silence. And for those who haven't been officially diagnosed but are experiencing persistent symptoms, joint stiffness, unrelenting fatigue, digestive issues that never go away, it's worth asking a doctor to run deeper tests. Many autoimmune conditions are misdiagnosed or overlooked in the early stages, especially in veterans. The longer they go untreated, the harder they are to manage. This isn't just about benefits. It's about getting the recognition and care you deserve. Because what you went through, what you were exposed to, didn't stay in the past. It followed you, and it may be affecting your health in ways you never expected. In our final section, we'll pull all of this together and talk about what most veterans still don't realize about these overlooked conditions, and what you can do if you've been denied. What most veterans don't realize is that the system isn't always set up to recognize what's really going on. Too many leave the service thinking their symptoms are normal, or that their struggles don't qualify because they weren't injured in a dramatic, obvious way. But compensation isn't just for the visible wounds. It's for the long-term damage, the conditions that develop slowly, quietly, and often go ignored until they've already changed your life. We've talked about 6 medical conditions that often slip through the cracks. From autoimmune diseases to chronic fatigue, from skin disorders to mental health struggles that don't show up on paper. These aren't rare. They're real, and the VA does provide support for them if you know how to advocate for yourself. That's the part no one teaches you. How to prove what isn't obvious. If anything in this video sounded familiar, don't ignore it. Don't assume it's just part of aging, or that you're the only one dealing with it, because you're not. Thousands of veterans are living with the same frustrations, the same questions, the same slow burn conditions that quietly took root years ago. And the worst thing you can do is stay silent. You don't have to face the system alone. There are veteran service officers, legal advocates, and medical professionals who understand how to build your case, how to link your condition back to service, even when the timeline doesn't seem to make sense. But it starts with awareness, with listening to your body, with recognizing that your story matters, even if it's not dramatic or obvious. The truth is, the price of service doesn't always show up in combat. Sometimes it's what follows you home, the things you breathe in, the stress you carry, the slow toll on your body that no one sees. That's what this video was about. And if it helped open your eyes, then we're already doing something right. We'd love to hear from you. Drop a comment below and tell us which part of this video hit home for you. Or share a story that others might relate to. When you speak up, you're not just helping yourself. You're helping others feel less alone. And if you haven't already, Consider subscribing and turning on notifications so you don't miss future videos like this one. Thanks for watching, and most of all, thank you for your service. You earn more than a salute. You earn the right to be heard, supported, and fully cared for. Don't settle for less.